this is how I turned this scar to this. Continue watching to learn how I treat different types of scars. Hi, I'm Dr. Peter Cheng.
I'm Dr. Loo.
I'm Dr. Chai.
So what are the types of scars?
There are two types of scar that commonly patients come to us. One type is actually a raised scar, another one is a depressed scar. The raised one usually is a keloid hypertrophy. We'll talk about it later. And the depressed scar is usually, we call it atrophic scar. So, Dr. Chai, would you like to give some example of the atrophic scar?
Yeah, examples of atrophic scars are like acne scars or chickenpox scars.
And how do we differentiate hypertrophic from keloidal scars? You know, a lot of patients will come in and say, oh, doctor, I have a keloid there. Then when you look at it, no, luckily it's not a keloid scars, it's just hypertrophic. Hypertrophic just means there's an elevation in the scars. But whereas for keloid, right, it's like a tumor, they got a lot of branches out. It branches out. And there may be vessels there. You can see very prominent vessels there. And it's something that can be very painful or can be very itchy. So it's something very disturbing.
And it's spread beyond the wound area.
Yeah.
Another thing that patients always come to us say that I have a scar, but when we examine the patient, it's actually not a scar. It's actually after the injury, they get a little bit of pigmented area, including red color or black or brown color. That's actually not real scar.
Correct. Those we call like post-inflammatory hyperpigmentation or post-inflammatory erythema. Post means after, inflammation means it's inflamed, it turns red. Pigmentation darker or red erythema. But all those we know that with time, it will improve with time. If it's a newly onset kind of inflammation. Unless the problem has been there for many, many years, then sometimes it can be permanent pigmentation or redness. But we don't consider that as a scar.
So is there a difference between old and new scar?
We always say, of course, an old scar is harder to treat. Yeah, new scars, the prognosis, the outcome will be better. So I always advise the patient to treat as early as possible. Even for acne scars, those days, many years ago, we used to think that you wait until the acne is completely stable, then only you start doing the scars. But now all the latest studies have shown that the earlier you treat the acne scars, even when you are still having acne, the better the outcomes. Right? And also, we know that and new scars, they tend to have this redness there. That means some scars you see there are a lot of vessels there. I always tell the patient, if you see that the scar has turned into skin color, that scar is not going to grow rapidly. But whereas if it's still a red scar, there is a chance that this scar is still growing. This keloid was still growing bigger and bigger. So we always have patients that come to us, asking us to prescribe creams for scars. Do you think that it works?
It actually depends on what type of scar. If it's very new and flat scar, you probably can try. But if let's say it's a hypertrophy or keloid scar or even a depressed acne scar, I don't think it helps as much. So what are the options that you actually give to patient when you want to treat the atrophic scar or hypertrophy scar?
So treatment options is actually we aim to improve the scar appearance rather than eliminate them totally. So it depends on which type of scar the patient have. If it's hypertrophic or keloidal scars, we can inject intralesional steroid to flatten it and also helps to reduce the pain and the itching.
Looking for the causes of the scar is also very important. Because we have a lot of patients that come to us with a lot of keloids on the chest. But when you look into it, it's actually the acne that causes the keloidal scars. So if you don't address the acne, you're just treating the scars, then forever patient keep on recurring scars over there. So when it comes to keloidal or hypertrophic scars, besides steroids, sometimes we can also add on things like hyaluronidase, 5-fluorouracil, all these things. And for very severe ones, sometimes we even inject botulinum toxin to relax the surrounding muscles. And also, botulinum toxin has been found to have some anti-inflammatory property in it. And if I see that the scars has a lot of vessels around it, I also use a vascular laser, trying to shrink the vessels.
Normally, how frequent do you do the laser injection?
We do once a month, because I always tell patients, you will see the effect after 1 month. Now, how many times do we need to do it? It depends on the severity. Some patients, you just do one time and it's good enough. But some patients, of course, you got to go for repeated sessions. Okay? And some, we may not even need to treat. Some patients are very happy with their scars. Unless some patients, of course, it's so disturbing, it disturbs their sleep because of pain, because of the age. And therefore, those are the patients that really, really need treatment. But as for atrophic scars, right, the treatment options is just like how we treat acne scars. That means we can use energy-based device, lasers. We can also use fillers, to fill up collagen stimulators to improve it. And if it's things like ice pick scars, all this, we can also use tricolor acetic acid to put on it.
We can also inject recombinant enzymes, which is rich in this collagenase, to pick up those fibrous tissue underneath the depressed scars.
Another simple method for atrophic scar is always the subcision that a lot of patients do it to actually break down the fibrous tissue.
So some of the patients also try to use some DIY method to treat scars, to treat those red scars. They think that it's like a mole or a lump there, that they can burn it off. So they put acid there, or they buy from online some acid or something to heat it up, but actually that makes the scar worse. Scars form because of the trauma, and the more you traumatize it, the worse it becomes. So scars comes in different shape and sizes, and there are so many different types of treatment to treat different types of scars. The earlier you treat, the better the outcome. So please talk to your doctor to find the most suitable options to treat your scars.